Welcome to the Healthcare Authority Community-Based Training. This is Module 1 of a 6-module online training program for community partners to learn about the changes in Medicaid under the Affordable Care Act and how to assist individuals with applying for healthcare coverage in the new Washington Health Plan Finder web portal. After completing the 6-part training program and passing the assessment test, community partners affiliated with a community-based organization will have the opportunity to apply for enhanced access in the Washington Health Plan Finder. This enhanced access allows community partners to assist individuals in applying for healthcare coverage through Health Plan Finder. They have access to provide additional assistance and can view an individual's account in Health Plan Finder for up to 30 days. The first 3 modules will provide an overview of Medicaid changes under the Affordable Care Act. Let's review our scheduled presentation in more detail. We will begin with a quick review of highlights under the Affordable Care Act. During this presentation, please note that we'll be referring to the Affordable Care Act as the ACA. Module 1 will cover Lesson 1, Changes to Medicaid under the ACA, Lesson 2, Income under MAGI Methodology, Lesson 3, Medicaid Eligibility with no changes. Let's review highlights of the Affordable Care Act as they pertain to Medicaid. Effective October 1, 2013, there is a new brand name for Medicaid. A new application web portal opened. We began to use MAGI methodology and have changed the renewal process for family, children, and pregnancy medical programs. Effective January 1, 2014, healthcare coverage is available under the new Washington Apple Health Adult Medical Program. Washington State Healthcare Authority is excited to announce the rebranding of our Medicaid program to Washington Apple Health. Washington Apple Health is the public health insurance program for eligible Washington residents. Washington Apple Health is the name used in Washington State for Medicaid, the Children's Health Insurance Program, also known as CHIP, and state-only funded healthcare programs. During this training, we will use both terms, Medicaid and Washington Apple Health, when referring to this public health insurance program. We'd also like to introduce the new method for individuals to apply for free and low-cost healthcare coverage. It's called Washington Health Plan Finder. The new application web portal can be found at www.wahealthplanfinder.org. This new application web portal, created by the Washington Health Benefit Exchange, began accepting applications for healthcare coverage on October 1, 2013. The ACA allows for a streamlined and simplified application process for children, pregnant women, families, and the new adult group. Eligibility determinations for these programs will be made through the new Washington Health Plan Finder web portal. Automated data matching will be used to verify Social Security numbers and citizenship through an automated data match with the Social Security Administration. Immigration status will be completed through a data match through Homeland Security. Income data matching will be conducted through the Federal Internal Revenue Service and Washington State Employment Security Department. Real-time eligibility determinations will be received after completion of an application and data matching through the new Washington Health Plan Finder web portal. As we previously discussed, renewals for family, pregnant women, children, and the new adult group will be completed in the Washington Health Plan Finder. Under the Affordable Care Act, states were given the option to expand Medicaid. Washington State has created a new program called Washington Apple Health for Adults, also referred to often as the new adult group. Washington residents between the ages 19 up to 65 who are not entitled to Medicare, not incarcerated, and have income below 138% of the federal poverty level will now be eligible for Medicaid coverage. This new medical program includes adults, such as parents who have dependent children, but previously did not qualify for Medicaid coverage as their income was above the family Medicaid standard. This new adult group will also cover adults, such as a young adult entering the workforce or a 50-year-old with grown children, both who have income under 138% of the federal poverty level. Here is an example of the income limits for the new adult medical group. A single adult could make roughly $1,320 per month, or around $15,850 per year, to be eligible for this new program. A family of 3 could make roughly $2,250 per month, or about $26,950 per year. The eligibility determination for Medicaid for family, children, pregnancy, and the new adult medical uses a new method for determining income and household composition. It's called MAGI methodology. MAGI stands for Modified Adjusted Gross Income. Adjusted gross income may be a term you are familiar with, as you may have seen this when completing an IRS tax return. Renewals will now be processed through the new Washington Health Plan Finder web portal for the following programs: family, children, pregnancy, and new adult. Federal poverty level standards for Washington Apple Health increased on October 1, 2013. They are now set at up to 193% of the federal poverty level for pregnancy, up to 210% of the federal poverty level for no-cost Washington Apple Health for kids, and up to 312% of the federal poverty level premium-based Washington Apple Health for kids. These increases were necessary to convert these from a net income standard to a MAGI income standard. We'd also like to share a new category being offered on October 1st for coverage to begin January 1st, 2014 through the Washington Health Benefit Exchange. Up to 400% of the federal poverty level health insurance premium tax credits, or commonly referred to as HIPTC. Let's talk about general Medicaid eligibility. Now let's provide an overview of the following key eligibility criteria for MAGI Medicaid, including criteria that will be changing, alien emergency medical, income reporting requirements, resource asset limits, income under MAGI methodology, and household composition. Criteria that is not changing: citizenship and immigration, social security numbers, retroactive coverage, residency, and incarceration. Let's begin with a review of the eligibility elements that will be changing under the Affordable Care Act. This includes alien emergency medical, income reporting requirements, and resource asset limits. We'll also go more in depth regarding the following 2 changes under MAGI methodology: income, including income of a child, and determining household composition. One key element of Medicaid that will have changes under the ACA is the Alien Emergency Medical Program. We'll refer to this as AEM during our training. The AEM program allows emergent coverage for individuals who, because of immigration status, are not eligible for Medicaid. Previously, to be eligible for AEM, an individual had to be relatable to one of the following programs: aged, blind, or individuals with a disability, pregnant women, children, or a parent taking care of a dependent child. Beginning January 1st, 2014, with the expansion of Medicaid to include a new adult medical group, more individuals will qualify for the AEM program. For example, a 25-year-old single adult male is injured in a car accident, which results in broken bones, requiring a hospital stay. Previously, this individual was not relatable to a Medicaid program and did not qualify for AEM. In January 2014, this same individual will qualify for AEM if his income falls below 138% of the federal poverty level. If this individual's income falls below 138% of the federal poverty level, then a non-grant medical determination is not needed. For those individuals relatable to MAGI Medicaid, the new Washington Health Plan Finder will support an application for the following programs: families, children, pregnant women, new adult group, and alien emergency medical. Just like previously, AEM will remain a 2-step process, including an eligibility determination through Washington Health Plan Finder and a healthcare authority medical determination of the emergent condition, which includes the client being sent a request for information letter for the return of medical evidence. Now let's discuss change of circumstances under MAGI methodology. As of October 2013, all programs under MAGI will have a $150 reporting requirement for income changes expected to last more than 1 month. There will continue to be no income reporting requirements for pregnant women and children. All resource asset limits are eliminated for MAGI programs. For example, previously, the Family Medical Program carried a $1,000 resource limit. Resource limits will no longer apply under MAGI. Let's now review income of a child, another one of the eligibility elements that changed under the Affordable Care Act. Previously, when a child had income, the assistance unit was set up using Sneed-Kaiser rules. Sneed-Kaiser rules specified how the separate income of family members who were not financially responsible for other family members affected the medical assistance eligibility for other family members. As of October 2013, the income of a child, age 18 or younger, is not counted if the child is not required to file taxes. If a child is required to file taxes, the income will count only in the determination of that child's eligibility. With Washington State's minimum wage of $9.19 an hour, a child working an average of 12 hours a week would earn enough to be required to file taxes. Let's review an example. A teenage boy, 17 years of age, works 8 hours per week at minimum wage. Based on the total income he receives, even though he files taxes to receive his tax refund, he is not required by law to file taxes, and his income is excluded. Let's review another example. This same teenage boy now works 16 hours per week at minimum wage. The amount of his earned income now requires him to file taxes. His income will count towards his Medicaid eligibility, but does not count towards his parents' or siblings' Medicaid eligibility. Now let's explore the new Modified Adjusted Gross Income, or MAGI. MAGI income is used to determine eligibility for the following Medicaid programs: children, pregnant women, family, and the new adult group. Countable income under MAGI Medicaid is income that is included in adjusted gross income for tax purposes, with a few exceptions. The new Washington Health Plan Finder application web portal is programmed to only ask for countable income. If the Washington Health Plan Finder questions are thoroughly answered, then the system will capture the correct countable income. Please be sure to guide individuals applying for health care coverage to only provide income types that are requested. Countable MAGI income is reduced by a 5% federal poverty level disregard across all MAGI Medicaid programs, which includes children, pregnant women, family, and the new adult group. This 5% disregard eliminates all other previous income disregards. Previously, there were multiple income disregards. For example, for the Family Medical Program, there was a 50% earned income disregard. For Children's and Pregnancy Medical, there was a $90 earned income disregard. These three existing programs also had child care and child support disregards. Again, these multiple disregards have been replaced by one 5% disregard across all four MAGI Medicaid programs. The following types of earned income are countable for MAGI Medicaid: wages and salaries, tips, commissions, and profits from self-employment. Let's review how income from self-employment is determined. If an individual has worked long enough to file a federal tax return for the previous year and it represents their current income, then the agency determines self-employment income by using the income and deductions claimed on the previous year's taxes. If an individual has worked for less than a year at the self-employment business or not long enough to file a tax return in the previous year, the agency determines self-employment income by averaging the income to come up with a monthly amount based on the period of time the business has been in operation within the last year. Adding together gross self-employment income and any profit made from selling business property or equipment over the period of time the business has been in operation within the last year, and subtracting business expenses allowed by the Internal Revenue Service. For those who are self-employed, the following costs can be subtracted from the gross income to determine net self-employment income. This includes, but is not limited to, car and truck expenses, depreciation, employee wages and fringe benefits, advertising, repairs and maintenance, and certain business travel and meals. Now let's review unearned income benefits. The following types of income are considered as countable for MAGI Medicaid, including railroad retirement, unemployment compensation, Social Security benefits, including retirement, disability, survivors, rental income, pensions, IRAs, military retirement, annuities, dividend payments, and per capita distributions from tribal gaming. Now let's review what is considered MAGI non-countable income, which includes employment and training programs, bona fide loans, federal income tax refunds, earned income tax credit, child support payments, and L&I. Additional types of income that are non-countable for MAGI Medicaid include foster care payments, Veterans Administration disability-related benefits and pensions, money withheld to repay an overpayment, one-time payments such as refugee resettlement grants, and income given to a sponsored immigrant. This also includes needs-based assistance from other agencies such as TANF cash, refugee cash, age blind or disabled, and SSI. The following income types are reported on an IRS tax return but continue to be excluded under Medicaid rules, including educational assistance, certain American Indian Alaska Native income, and lump sums. The Washington Health Plan Finder will only ask for countable income. For more information on these income types, please review the WACs referenced on this slide. Now let's review Medicaid eligibility with no changes. Let's begin reviewing citizenship and immigration eligibility rules that will not be changing. Individuals who are not citizens will fall into 4 categories. The first category is those that are exempt. These are qualified aliens who are exempt from the 5-year bar. The 5-year bar is the waiting period necessary for a legally residing alien to receive Medicaid. The exempt category includes, but is not limited to, the following groups: refugees, asylees, Amerasians, victims of trafficking and their family members, and Cuban Haitian entrants. The next category is not exempt. These are qualified aliens who must serve a 5-year bar prior to becoming eligible for Medicaid. Our third category is non-qualified aliens. These are non-citizens who are lawfully present but not considered qualified aliens. Non-qualified aliens include, but are not limited to, citizens of Marshall Islands, Micronesia, or Palau, immigrants paroled into the U.S. for less than 1 year, immigrants granted temporary protected status, or non-immigrants who are allowed entry into the U.S. for a specific purpose, usually for a limited time. This includes business visitors, students, and tourists. Our last category is undocumented aliens. These are individuals who have entered the U.S. illegally or whose immigration status has been revoked. Exceptions to the 5-year bar. Pregnant women and children are eligible for Medicaid with no wait period, regardless of their immigration status. Lawfully present non-citizens will enter the following information into Washington Health Plan Finder: passport number, country of issuance, and date of entry into the U.S. If none of the above information is available, an individual will enter their A number or other immigration number. Those individuals who are not applying for medical or who declare they are not residing legally in the U.S. will not have their information sent to Homeland Security. Residency requirements continue to follow existing Medicaid rules. A Washington resident is an individual who states that they currently reside in Washington State and intends to live in Washington State, entered the state looking for employment, or entered the state with current employment. Social Security number requirements continue to follow existing Medicaid rules. Each individual who applies for or receives Washington Apple Health must provide his or her valid Social Security number. Washington Apple Health coverage is not delayed, denied, or terminated pending the issuance of a Social Security number by the Social Security Administration. An individual who does not provide a Social Security number is not eligible for Washington Apple Health coverage unless they meet one of the following exceptions. An individual who refuses to apply for or provide a Social Security number based on religious grounds. An individual claims good cause for not providing a Social Security number due to domestic violence, or a newborn as described in WAC 182-505-0210, Section 1, is eligible for Washington Apple Health coverage until the baby's first birthday. There is no Social Security number requirement for the following: Washington Apple Health Refugee or Alien Emergency Medical, Washington Apple Health programs for children and pregnant women who do not meet citizenship criteria described in WAC 182-503-0535, or a household member who is not applying for Washington Apple Health coverage. Qualified and non-qualified aliens, as defined in WAC 182-503-0530, who are not authorized to work in the U.S., are not required to apply for a non-work Social Security number. Rules around incarceration will not be changing. Once an individual is placed in a city, county, or state institution, they are no longer eligible to receive Medicaid coverage. Healthcare Authority has worked with city, county, and state correctional facilities to create a process for inmates to apply for medical coverage at the time of release. Retroactive coverage requirements will continue to follow existing Medicaid rules. An individual may apply for retroactive coverage for unpaid medical bills incurred within a 3-month period prior to the month of application. To receive retroactive coverage, an individual must request this during the application process or within the certification period. Please note that families will receive notification of retroactive eligibility through a separate notification letter. Retroactive coverage will be determined outside of the Washington Health Plan Finder, and families will not receive a real-time determination. Congratulations! You have completed Module 1 of the Healthcare Authority Community-Based Training. Please continue on to Module 2 of the 6-module Healthcare Authority Community-Based Training.